Think we're live.
Awesome.
All right. All right. Hi everyone. My name is Alex, and I'm here with
Silver.
Wilbur. And we're
Think we're
here
live.
to. Oh, sorry. I have my thing in the
Awesome.
background. Okay. Okay. Yeah. So we're here to welcome you to our MedLife Service Leadership info session. We're glad you're here, and tonight we'll be walking you through who MedLife is, what we do, and what a service leadership is, most importantly, and how you can get involved through our UBC Vancouver chapter. At the end of this, we'll also share some details on some scholarships, logistics, and any other questions you may have. Okay, so what is MedLife? Well, MedLife is a nonprofit organization. We partner with low-income communities in South America and Africa. Our mission at MedLife is to improve access to healthcare, housing, and education in these underdeveloped communities. One of the main ways MedLife does this is by connecting volunteers, students like us from universities and high schools around the world, to these communities that need support. There are two main parts to MedLife's work. The first part is obviously the service leaderships, which is what we're going to talk about today. But we also have what we are, an on-campus chapter too. So these on-campus chapters allow kids in the university to get involved with other local volunteer opportunities, like our Point Grey Hospital opportunity. These are how us students can stay involved all year round, because SLTs or service leaderships only last around 1 week.
Awesome. So now here's some numbers that show how big of an impact MedLife has had so far. So for some stats, MedLife has grown to over 300 chapters at different universities and high schools. Over 20,000 volunteers have traveled abroad with MedLife, and through service learning trips, MedLife has conducted more than 350,000 patient consultations, which is a very huge number. And development projects have supported over 105,000 beneficiaries, whether through building homes, staircases, or sanitation facilities. And during the COVID-19 pandemic, MedLife provided over 2 million meals to families in need. What's exciting is that these numbers are still growing. Every year, more students get involved, more communities are reached, and more lives are impacted. Awesome. So now let's give you some information on where MedLife works. Well, MedLife currently operates in 5 locations: Costa Rica, Guatemala, Ecuador, Peru, and Tanzania. Each location has unique challenges and opportunities, whether it's urban poverty in Lima, rural communities in Ecuador, or underserved populations in Tanzania. Volunteers get to learn more about specific realities of these communities while contributing to meaningful projects.
All right, so this is kind of going to be a lot in one slide, but let me try to get over it. So what is a service leadership, and what do you do? So these service leaderships are a week-long journey that is educational and fulfilling, where volunteers work hand-in-hand with local communities to participate in mobile clinics and local projects. So what will you do in these trips? Well, like I just said before, you'll participate in mobile clinics. These are what you'll be doing for most of the service leaderships. These mobile clinics bring free, high-quality healthcare directly to communities that otherwise lack access to doctors or hospitals. These clinics are staffed by local licensed professionals: doctors, dentists, nurses, pharmacists, and volunteers like you help run the stations, assist in triage, and shadow medical staff. Another thing you'll do on the last day is contribute to community development projects like building staircases, water systems, bathrooms, or schools. Many of the communities that MedLife partners with don't have basic infrastructure, so these projects are chosen directly by community leaders to meet their most urgent needs. On the first day, you'll participate in a reality tour. This is just a tour by local residents. They'll help you guide you through their neighborhood and share what life is like. This gives us a deeper understanding of the challenges they may face and why the development work is so important. This is also a great way to get involved in another culture. We'll also support some educational workshops, which will basically just be us teaching patients about actual healthcare. These workshops cover topics like nutrition, diabetes, breast and cervical cancer screenings, and just general hygiene. They also help patients learn how to live healthier lives and prevent future illnesses. We also have optional excursions, which we'll get into later. Altogether, SLTs are designed not just for us to help, but also for us to learn too. Okay, how does MedLife help you develop? Well, there are many ways, many benefits to participating in a service learning trip. One of the few things you'll do is challenge yourself and grow. These service learning trips can give us a new perspective on life, help us reflect on our career path, and develop leadership and cultural competency skills. This is mostly done by volunteering in these underdeveloped communities. Probably one of the most beneficial things is gaining hands-on clinical experience. I know a lot of people who want to be in this club probably want to have some sort of volunteering. So this will be a good chance to work alongside real healthcare professionals, shadow doctors, participate in clinics, and yeah. This is also a good way to network with others. You'll meet students from around the world, and you can form friendships and professional networks that might last a lifetime. Contributing to community development, like I said on the final day, you'll be directly impacting and supporting these communities. This is also a good way to get exposed to different healthcare systems and cultures. Obviously, healthcare in these places might be different from ours, so you see how they could be delivered in an area with more limited resources. And advocacy and activism. Many volunteers also return home inspired and advocate for social justice and raising awareness for people in need.
Awesome. So before we go into the details of what a week looks like, here's a short video that shows what you might experience on an SLT.
Alright, so as I was explaining before, this is a more tentative schedule of what SLT should look like. So as you can see on the first day, you'll be flying in, and the first full day, you'll be going through a reality tour. Basically, most of this is going to be guided by the local professionals and the local leaders, and the MedLife staff. This will give us a good chance to learn about the community we're working in and get more involved in the culture. And then from day 3 to 5, this is where all the mobile clinics are. So you'll be rotating through these different stations and shadowing the professional doctors, dentists, pharmacists, and nurses. On day 6, you'll be going to do the development projects. So these are usually, depending on where you are, you could be building schools, building stairs, or helping fix water systems. And this is a good way to just help the community and handle more urgent matters that local leaders would like them to fix. And then day 7, we have optional tours. So if you are interested in an SLT, there are some optional tours you can add on. These will come at an extra cost because service learning trips do cost money. These optional tours do come at extra cost, and they could be from educational to more fun, Or if you don't choose one, if you plan to not choose one, you can just spend the day on your own, maybe with some friends you made, or just enjoying the nature and the community.
Awesome. So during mobile clinics, there are 7 stations that volunteers rotate through. Number 1 is triage, which is the first stop for patients, where volunteers help report vital signs like weight, height, blood pressure, and temperature. Next, we have education. This is where we this is where we teach patients about preventative health topics, such as nutrition and hygiene. This is also where patients wait to see a doctor. So volunteers have a real chance to share knowledge that can create long-term impact. Next, we have general medicine. So this is where people who go on the SLT can shadow local doctors as they examine and diagnose patients, giving all of y'all an up-close look at healthcare challenges. Next, we have dental. So assisting dentists with cleanings, fillings, and extractions. Volunteers help with tools, sterilization, and forms. Next, we have OBGYN, which focuses on women's health, with screenings like breast exams and cervical cancer checks. This station is only open to female volunteers who shadow OBGYN specialists. Next, we have pharmacy, which is where patients receive their prescribed medications. Volunteers help nurses organize and distribute the right medicine. And lastly, we have toothbrushing, a 100% volunteer-led station teaching children's ages 3 to 11 how to brush properly. Each child receives a toothbrush and fluoride treatment. So each day you'll do 2 stations, one in the morning and one in the afternoon. Which stations you do may depend on location and number of volunteers.
Thanks, Philbert. So MedLife, at MedLife here, we like to do a patient follow-up program. So the care that we do for these patients don't stop at just the clinics. If a patient has a chronic or severe condition that can be treated at the clinic, they're enrolled in the patient follow-up program. Basically, after the mobile clinics, MedLife nurses visit patients at home, do socioeconomic evaluations, and figure out what barriers they're facing. This might include. This will also help us help us get them support. This will help us maybe connect them patients to real specialists, helping them schedule appointments, providing funding for procedures like for their homes, or even organizing development projects to address their living conditions. This ensures MedLife isn't just doing short-term volunteer work, it's building long-term relationships and solutions with the community.
So here is some information about one of the main MedLife locations. It's Lima, Peru. So Lima is a modern sprawling city with around 10 million people located on the arid coast of Western Peru. But MedLife works in the outskirts of the city. These are informal settlements where thousands of families have migrated from rural Peru in search of work and stability. Many came during the 1980s, escaping violence in the countryside. Unfortunately, these areas are marked by poverty, lack of infrastructure, and limited government support. MedLife partners with these communities to improve health and living conditions. To give you a better picture, here's a short video showing the area and the people we work with.
So here are some FEMA logistics that if you do go on a trip which is the main ones that we would like you to go on are the Lima ones. If you do like to go on a trip, here's some logistics. It could be the weather there isn't too much different from ours. As you can see in the winter, it's a bit warmer than our winters, but their summers are pretty similar to ours, maybe a bit warmer. Physically demanding. There's a lot of city terrain and a lot of stairs. The places we'll be working in are very hilly, but you wouldn't be walking up to my hills. You're doing a lot of volunteering in the city, and there's a lot of places you can explore on your own. We'll get into accommodation, meals, and later, and the payment options later too. Philbert will also go over what to pack.
Awesome. So here's some packing tips for those who are going to Peru. You want to bring lightweight, breathable clothes for the day, plus a light jacket for cooler evenings. You also want to wear comfortable walking shoes because we'll be standing a lot. And sunscreen, a hat, and reusable water bottles are all important. A portable charger and a good backpack are highly recommended. And lastly, bring some local currency for small purchases.
Thanks, Philbert. Okay, so we have pricing. So what is included in the price of a service learning trip? Well, the trip fee covers almost everything: accommodation, meals, local transportation, and all program costs. The one thing that the service learning trip does not include is flights. Now, from Vancouver, flights can range from $600 to $1,000 Canadian depending on the season. We strongly recommend booking early or going on an off-season time to get the best price. Once your service learning trip is confirmed, MedLife will set a WhatsApp group with coordinators and participants to help updates and travel planning. That is when you should be booking your flight. So if a trip does fill up in time, you can book a flight a bit more early. Here's some also other things that the pricing does cover. So yeah, you should register early. There are a few good reasons. Obviously the longer you wait, the more expensive flights will get. And MedLife also needs to know how many volunteers are actually going so they can coordinate with the communities in advance. If you do pay before these certain deadlines, there will be discounts. You also have the option to paying your entire balance up front if that's easier. But if you want, you will be paying $200 USD deposit, and then you'll be paying the rest just a few months before your trip. On one important note, if you do feel sick before your service learning trip, you should let us know as soon as possible. MedLife can provide a full refund, minus the $200 deposit though, so don't worry, your money won't go to waste.
Yes, sorry for being muted.
That's okay.
Yeah, I just said all that while being muted. But that's okay.
That's okay. Sorry, Philbert.
Awesome. All good. And here's some testimonies from students who've gone on past SLTs. They'll give you a sense of what the trip is like, how impactful it was, and why it meant so much to them.
Hi, my name is Kayla. I'm from the University of South Carolina.
My name is David. I'm from Wiley High School in Abilene, Texas.
Hi, my name is Emmy Thomas. I'm from Indiana, and I'm part of Murray State's MedLife chapter.
My name is Rolla, and I study at White Oak Secondary School in Oakville, Ontario, Canada.
My name is Dustin Rendell, and I'm from the University of Florida.
Saludos a todos, mi nombre es Wilheiska Acevedo. Soy la siguiente presidenta del capítulo universitario de MedLife de la UPR en Aguadilla.
I think there's a lot of different benefits that MedLife can provide to everyone. The first is that you really get direct patient experience. You really get to learn from a lot of different people about a lot of different diseases and disorders, how they affect different people. On top of that, you really just learn a new perspective. on how medicine is so important and on how education on medicine is important, and how development and prevention is so important for all of that on top of it.
Definitivamente las clínicas han sido una experiencia muy bonita, sumamente gratificante. Hemos aprendido un montón en conjunto con los otros doctores y en todas las rotaciones. Y definitivamente una experiencia muy gratificante y bonita.
MedLife has brought about so many amazing opportunities. From this SLT alone, I've really broadened my idea of what medicine can be and how it doesn't have to be, located in one place, but rather, medicine can be distributed to the community where you're able to give back and have a more positive impact.
It made me a lot more socially aware to things, and especially since I do want to pursue a career in healthcare and do more NGO stuff like this. It's definitely helped me a lot with that and helped me gain a lot of experience at such a young age, which will definitely help me in my future.
Yeah, so being able to volunteer, especially in a place like Lima, Peru, is really interesting because you get a whole new perspective on what the world is like. Because I'm from Abilene, Texas. It's a pretty small town in Texas, and that's pretty much the entire world I've lived in. But being able to travel and go somewhere that I've never been to, be able to help those people, is a very rewarding experience. And also, I think it's given me a wider perspective on what the world is like, because I've never really traveled this far ever. So it's a really interesting experience to have, especially as a high schooler, to be able to have those types of experiences.
So I was originally supposed to come here by myself, and I was really nervous to be traveling to a foreign country by myself, never having left the United States before. But MedLife has really made it a really smooth transition for me. It was super easy. I absolutely loved it. I've always felt safe. I've always felt comfortable. And trying to get other people to come at first was difficult. But once I did, Celine, the other one who came, she's having an amazing time just as I am. And I'm going to do everything I can to get more people to come because I truly believe that this is a life-changing experience.
So I am a pre-med student at Murray State, so obviously I will be heading off to med school in a couple years. So not only will this provide job shadowing and volunteer hours, but will also, better me as a person and prepare me for, what's ahead in my medical career, to be the best person I could be for my patients and the people around me.
Ellos van a notar que yo verdaderamente tengo un compromiso con ayudar a las comunidades, por ejemplo esta en Tamarindo, Costa Rica, y que verdaderamente hay que ayudar y servir a las comunidades porque verdaderamente lo necesitan.
Yeah, so of course chemistry is a little bit different than medicine, but I still think it has a similar application for this because I worked in the pharmacy section here in clinic, and I've realized how important it is for these different pharmaceuticals to be accessible to different communities, and through chemistry I'd be able to help in that way. So it really doesn't matter what career you go into because all those careers are really able to converge into the medicine field and also on a wider perspective to help people on a grand scale.
So I think if you're unsure about coming into an SLT, I think you absolutely should do it. If you have any questions, MedLife has been more than helpful answering them. This is something that you can't experience anywhere else. This is something that is going to change your life and really help advance your professional career. So if you're unsure, I'm here to tell you to do it. Come on the SLT, Power Hour, Moving Mountains. They're extremely important, they're extremely valuable, but there is nothing like the SLT to really change your perspective and advance your personal careers.
I can tell the volunteers that are, a little hesitant about coming that this has truly been the best couple of days of my entire life, and I wouldn't trade it for the world.
No se van a arrepentir, es una experiencia muy, muy bonita, sumamente gratificante y verdaderamente se llevarán un recuerdo de esta experiencia para siempre.
So me personally, I was also unsure to come to the SLT because it's completely different. All the food is different, the people are different, and the environment's different. But it's all about stepping outside of your comfort zone to be able to grow. So this was an incredibly rewarding experience, and it's not even over yet, and I'm already having a blast.
100% worth it. I've had so much fun. You meet a bunch of people, make a bunch of new friends, and it feels good to help out and do all of these things, and it's a fun little getaway for a little while as well, and I think it's so worth it, and if you're thinking about it, you should 100% do it.
So one final thing before the end of our info session is going over the scholarships that we have. So since if you do sign up for an SLT through our chapter at UBC Vancouver, we have scholarships. There are scholarships for our general members, These will bring the cost down from an SLT from 1660 USD to just around $1,000. That's around $600 USD. These scholarships are first come first serve. So we did create a sign-up form where you can register for a general member as a general member, sign up for the SLT, and learn how to apply for the scholarship. It should all be in our link tree. If you don't have our link tree, you can add us on Instagram at MEDLIFE UBC, and our link tree should be there. If you don't know, if you do come up to the form, there is a part where they want you to ask about our chapter. Currently, our chapter has not been fully set up through the MEDLIFE program, so you can just select No Chapter and then write University of British Columbia under our campus name. If any more scholarships are available, you will most likely get an email with some sort of discount code probably around a week later, and you can use that code for any trip in Lima. You can only use it in the Lima locations. We also have some starred ones that we posted in the link tree. If you do want to go to those ones, those are ones that some students, some executives are planning on going on, so you can go with some of us. If not, though, if that doesn't fit in your schedule, you can go on your own on a different date as well.
Awesome. And that brings us to the end of our session. Thank you so much for joining us. We really appreciate you being here. And if you have any questions, feel free to drop them in the chat or ask us directly. We're happy to help with anything, whether it's about logistics, costs, scholarships, or what to expect on a trip. We can't wait to see some of you on a service learning trip soon. Thank you.
Thank you. So I'll be looking at the chat for the next around 5 minutes, maybe. So if you have any questions, please post them in the chat, and I will message them. I will either say it, I'll try to answer them to the best of my ability. So about the scholarship. The scholarship is for a lot of people, so they usually have a lot of scholarships. They are first come first serve, but not within our chapter. They're kind of with other chapters. From what I've heard from our chapter coach, which is someone who's helping us through the chapter, there are still scholarships available. So if you just sign up, if you are planning on going on a trip and you sign up for a scholarship as you right now, you will get the discount. You probably will get the scholarship as of last week. That is the information I have. Yeah, so there isn't an exact number for our chapter. It's really just whoever wants to sign up for the scholarships. You don't need to, there's not a certain limit on the amount of scholarships people can get, but yeah, it's basically a limit of how many people are going on trips from all around. So for example, I applied for a trip late August and finished and applied for the scholarship for that trip early September. So I finished my booking early September, so and I still got a scholarship. So there should be still scholarships available. They usually differ per like season. So we have the summer, spring, and winter ones. So if you want to apply for, so I applied for a summer one, so maybe that's the reason there is a scholarship. But if you do apply for a winter one, there probably still is a chance you can get a scholarship. Okay, so the areas are very safe. Usually the MedLife staff will keep you safe. There's a lot of transportation by them, and as you saw in the testimonials, some people, they said they felt really safe. It really depends on the area you go. The Lima trips are usually the most popular, so there usually is, depending on the time, usually around, I think at the most I've heard was like around 100, but on average they usually have maybe 30 to 50. I'm pretty sure there might be more or less depending, but there also is a limit. So if you do apply for a trip, there will be at least 15 people. 15 people do need to apply for a certain date to go, for the trip to actually go. Usually that does happen. I haven't heard of any moments where there isn't 15 people on a trip, but usually it's around 30. I think that's a good middle ground number. I'm going to leave the questions open till around 7:40, and then we're going to end the stream. The stream will be recorded, so if you did miss anything, you will put the info session link or the link to the stream in our link tree, so you can rewatch it if you missed a point. Yeah, so for that trip at the moment, our president, Jay, is actually signed up to go for that one. Owen, one of our executives, and me are signed up to go on the summer one. But Jay is the only person that is signed up to go during that time. If you do, I can get you in contact with her if you want to ask her any more questions about that trip in specific. We're only starting out right now, so we don't really have any new general member people signed up. So this is a pretty new club. Alright, if there's no more questions, that will be the end of the info session. I just want to thank you guys for watching and staying through the entire thing. It means a lot. And yeah.